Hello, and thank you for joining us for today's hybrid education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Exercises for Balance. Before we begin, if this is your first time joining us, CSC South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join our community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask you to keep your microphone muted to eliminate any distracting background noise. Please feel free to enter your questions into the chat function found at the bottom of the Zoom window at any time. Without further ado, I'll introduce our workshop speaker. Dr. Chang is an assistant professor in cancer rehabilitation medicine at Oschin Comprehensive Cancer Center at Cedars-Sinai Medical Center. He completed a residency in physical medicine and rehabilitation at SUNY Downstate, followed by a fellowship in hospice and palliative care at Montefiore and a fellowship in cancer rehabilitation at the University of Michigan. He has published on numerous topics in cancer rehabilitation medicine with a focus on pain management in cancer. Thank you so much for being here with us today, Dr. Chang.
Yeah, thanks so much for having me. I think my mic is working. I'm gonna assume that it's working. Anyways, hi everyone. Thanks so much for joining. I'm Phil. I'm gonna be just talking about a bunch of different exercises that can be done to kind of, practically improve balance. So hopefully this can be useful for some people, and thank you for everyone joining at home. So let's see. So we just have a few objectives. Not going to talk for a super long time, but I just want to kind of go over the dangers of falling, different components that kind of give us our ability to maintain balance, the use of various assistive devices that can help with balance, as well as different exercises, that we can do to improve our balance. Okay, so falling is, can be extremely disruptive, extremely damaging. And falls are actually the leading cause of morbidity and mortality in older adults worldwide. In America, among older Americans, it's the leading cause of injury-related death. And over 25% of Americans who are aged over 65 fall every year. 1 in 5 falls in older adults results in fractures or head injury. And 79% of falls occur at home, usually either in the bedroom, on the stairs, or in the bathroom. And if you have a slower walking speed, or if you are afraid of falling, those tend to be predictive factors for falling. So if you fall into kind of one of those boats, then it's something that you have to be particularly careful about. Okay, so yeah, there's a lot of different consequences. Like I said, probably the biggest thing is hip fractures. It's really not uncommon, especially if you have a history of osteopenia or osteoporosis, where you have kind of weakened bones. That you can have a hip fracture, and if you get a hip fracture, you're gonna go in the hospital. They're gonna have to do surgical repair, and then it's not uncommon that you might need to go to a skilled nursing facility for weeks to months even. So really big issue. And then again, head trauma and head injury can occur, and depending on if you're on blood thinners or if your platelets are low, the chance of a bleed in your head can also be quite significant. So, this is not something to mess around with. Balance is extremely important. It's the number one thing kind of in preventing, these kinds of injuries that are secondary to fall. So really, really important topic. Okay, so I don't want to spend too much time on this, but I just want to give us a relative understanding of kind of all the different components of balance. This is kind of a simplification. It's not entirely comprehensive, but there are a lot of different factors that go into somebody being able to maintain their balance. And you just want to be careful, because if one of these factors is off for you for whatever reason, then your ability to maintain balance is impaired. And if you're kind of missing a couple of different things, or you have 2 areas of impairment, then it'll just be more difficult to maintain balance. So you just even more important to be careful. Okay, so the components we're going to go over are somatosensory input, motor output, cognition, as well as navigating the environment. Okay, so one of the first really big things is our vision. So you just need to be able to see where you're going. For anybody who has kind of been through chemotherapy and maybe they have a history of neuropathy caused by the chemotherapy, they might know that, you know, when you're in the shower, for instance, and you're standing and then you close your eyes because you don't want to get soap in your eyes from whatever, that your balance can become a lot harder. Or, you know, if you're, you know, getting up in the middle of the night and all the lights are off and, you know, you're going to the bathroom, that's honestly when most people fall. It's like, you know, getting up in the middle of the night to go to the bathroom because you can't see. So our vision is such an important key, and especially in anybody who, you know, has other deficits like nerve problems, it's so important to be able to see. So if you think, you know, this is something, an area that can be improved, like, you know, maybe you have vision impairment and you need new glasses, this is something that you definitely want to do. Or if you have cataracts, and, you know, you've been thinking about maybe talking to your ophthalmologist about getting cataracts removed, that's definitely something you want to do. But you want to optimize your vision as much as possible. It really is quite an important thing. Okay, the second component is your vestibular function. So our vestibular function gives us our sense of equilibrium, and I'm not going to go into too much detail. I'm not an ENT doctor, so this is a little bit outside of my realm, but basically in our inner ear, and you can kind of see the blue semicircular canals like on the bottom image there. That's like where all these like little hairs are, and like, you know, the hairs kind of move in response to like your head positioning. And, you know, it's kind of like, you know, your phones, how in your smartphones, it can sense like, you know, positioning. That's, you know, this is kind of like our internal GPS. It tells us like, you know, just gives us our sense of equilibrium. So, you know, for anybody who's ever suffered from like vertigo or sensations of like the room spinning or yourself spinning, I mean, it's usually a problem like in this area. So again, if this is something that you experience, any vertigo symptoms, or you know that you have like an inner ear problem, I mean, not all of that can be addressed all the time, but sometimes it can, especially if it's something like from benign positional paroxysmal vertigo, which is caused by like these little calcium like crystals that can form in your ear. That's very, very treatable. So again, if this is something that you're dealing with, then, you know, talk to your primary care doctor. Maybe they'll refer you to an ENT doctor. Maybe they'll send you for special vestibular rehabilitation. But all those things can be really, really helpful, because again, we want to optimize all of the different components of balance to make sure that we don't fall. Okay, the third component, and this is also somatosensory input. So what somatosensory input means is basically everything that it's the way that we, you know, take in everything from our external environment, and that, you know, lets us know what to do in response to, you know, things that we see, things that we, you know, see or feel, and other things that we can sense. So proprioception is basically your body's ability to know where your muscles and joints are in three-dimensional space without looking. So if you've ever been tested for neuropathy and like you see the doctor and like maybe they take your socks and your shoes off, they might like move, they'll tell you to close your eyes, and they'll move your toe up and down, or they'll move your ankle up and down, and then they'll say, is your toe up or down, or is your ankle up or down? Or they'll do it with your hands and your fingers, and they'll be like, you know, is your finger up or down? Is your finger up or down? And if you can't tell, or if you have trouble telling, that means that you may have impaired proprioception. And again, that's very, very common for people who receive certain kinds of chemotherapy, specifically vinca alkaloids or platinum-based chemotherapies. That's very, very common in. So, you know, again, another kind of test for this is if you close your eyes and then you feel like really, really off. Proprioception is a large way of how we keep our balance when we're not looking. So again, because proprioception damage comes from nerve damage, as of now, we don't have great ways of dealing with that or reversing that. But it's something you should be aware of, because again, we want to optimize everything else that we can. Okay, so motor function. So aside from, you know, taking in all these different being able to see, you know, what's going on, having our equilibrium intact, and like knowing where our bones and joints are. We also need motor function. That basically means strength. Our legs have to be strong enough to hold us up. We need reflexes that are intact to a high enough level that, if we do trip on something for whatever reason that we didn't see, that, you can kind of catch yourself. So all those motor pathways have to be sufficiently intact. And then finally, cognition is really, really important for people who, for whatever reason, maybe they have like a serious infection that's clouding kind of their mental acuity, or maybe there might be like a history of dementia. But if you don't know kind of where you're going, or you're confused about which direction you're supposed to head, that will also very much affect your balance. And again, if that's something that's going on, really important that you talk to your primary care doctor or your neurologist or whoever you're seeing for those kinds of issues to see if there's anything that can potentially ameliorate that. Okay, so let's talk quickly about kind of center of gravity and center of mass. So my dot here is not exactly accurate. I made a lot of these images using ChatGPT and it's not quite there yet. But in any case, so your center of mass is somewhere, you can visualize it somewhere kind of around your belly button level. And it would be like it's basically in front of your spine around the level of your belly button. So physically, as long as your center of mass, and this is assuming that you have like the strength needed to kind of hold yourself up physically, as long as your center of mass is within your base of support, you cannot fall. So what I mean by this is you can see in the image on the left that orange triangle around this person's feet represents their base of support. So again, your base of support is just the outline around your feet. And so, if I'm standing here and I'm standing with a really narrow kind of chin, and right now my center of gravity is within my feet, within my base of support. But then as soon as I start leaning over to the point where my center of mass, center of gravity falls outside of my base of support, then you will fall. So that's why canes and assistive devices like walkers are useful, because the point at which that device is touching the ground, it increases your base of support by wherever it's touching the ground. So you can see in the middle image, the cane is kind of expanding the base of support, and then kind of the most stable thing would be a walker, because your base of support is expanded by the entire walker. So I could be holding on to something and then switch this way or this way. And that's essentially what you're doing when you widen your gait. So when you widen your stance and you're like your feet are far apart, my base of support is much wider now, so I can lean really far over either direction and not fall, because again, you're maintaining your center of gravity, center of mass within your base of support. So with that said, there's all different kinds of canes, all different kinds of like walking assisted devices. And this may be something that you just need again to kind of increase your base of support so you don't fall. And it may not always be permanent. Like for example, again, I keep going back to chemotherapy and neuropathy. It is one of the most common reasons why people with a cancer diagnosis end up with poor balance and falling. But yeah, again, nerves in most people will heal over time, and maybe just for that period of time, while your nerves are kind of healing, then you might need an assistive device like this. So on the far left, we have a single point cane. And what that means is it just touches the ground at one point. And then in the middle, we have narrow base quad canes and wide base quad canes. And again, those are just more stable because there's a much larger area where they're touching the ground. But maybe you don't need that. Maybe you just could get by with some like walking sticks or hiking sticks. And all this stuff is available on Amazon. You can just go to Amazon right now, and it'll be like 10 to like 30 bucks for any of these things. And yeah, just some walking sticks, hiking sticks. People use these kinds of things all the time. But again, they all will help to increase your base of support. And then maybe you're kind of needing a little bit more support than what could be provided by a cane or some hiking sticks. So that's where all these kinds of walkers come in. Into play. So on the far left, a lot of people have probably seen those before. We actually call those rollators, and those have much more mobility because the wheels at the bottom, they can kind of turn easily. So if you just push it a little to the left, it'll kind of turn automatically. Whereas like wheels on standard walkers, like is seen in the pictures in the middle, that the wheels don't turn, so they can kind of only go straight, and you have to apply it kind of like a lot more force to turn it. So depending on again, strength and how good your balance is, a walker may be a better bet as opposed to a rollator. The next image next to the walker with two wheels is that we call that a hemi walker. So sometimes people who have particular weakness on one side, they might use that. And then there are also four-wheeled walkers, a little bit different from rollators because again, the wheels aren't like spinning, so it's more stable than kind of what a rollator would provide. And then there are all different kinds of attachments for walkers. So for example, some people, they have like weakness of their hand, so it's hard to like grip the walker, or they may have pain, like very bad carpal tunnel syndrome or something like that. So there are platform walkers, and essentially these platform walkers, they have, you can see in the bottom picture, I kind of circled in red the area where the platform things are. So you basically would put your forearms are on there, and then you can just kind of push, so most of the weight is going through your forearms and not affecting your hands as much. So depending on certain situations, these different kinds of devices can be helpful. And then finally, there's different kinds of gait belts. So gait belts are basically for somebody who's with you to be able to grab onto you if you are about to fall. So really give for caregivers and caretakers, especially if balance is particularly bad, or if you're hearing words from your physical therapist or your doctors, like you need constant supervision, like someone has to always be watching you. If that's the case, then yeah, whenever you're getting up and moving around, you probably should get one of these. And there's a lot of different kinds, again, all available on Amazon, 10 to like 30 bucks. A lot of people like these, and I don't work for Amazon, just throwing that out there. Yeah, so a lot of people like the ones with handles just because they're easier to grab. You don't necessarily have to have one, and there's all different kinds. But yeah, just something to keep in mind if your balance is particularly off. Okay, and then one of the other things I want to talk about is medications. They can really frequently contribute to falls, usually because they make you feel dizzy or lightheaded. Really common with a lot of the medications listed here. So antidepressants, medications for anxiety like Ativan or Xanax, antipsychotic medications like Seroquel, beta blockers for your heart, water pills like loop diuretics, any kind of opioid medication, a lot of medications for nerve pain like Lyrica or gabapentin. A lot of these medications can basically increase fall risk. So whenever you can, it's best to not be on anything if you don't need it. So always kind of be in conversation with your doctors and your medical teams about do we still need this? Can we get rid of it? Because sometimes stuff just gets continued. So really important to get rid of anything that you can to kind of minimize the harmful side effects for these kinds of things. Okay, so optimizing your balance and reaching your full potential. So like I said, for people struggling with neuropathy, we don't have a magic pill yet to kind of fix nerves and to facilitate nerve healing. But that doesn't mean that your balance can't improve. And this is something I see all the time. I see people who fall relatively frequently. And if I ask them to stand with their feet together, they just can't do it. Or if I ask them to stand on one leg, they just can't do it. But within a relatively short period of time with physical therapy of 2 or 3 months, they can really gain balance back. And because even within the confines of whatever is wrong with your somatosensory system or within your strength, it's very unlikely that you're operating at what your full potential is. There still will be a ceiling based off of what kind of nerve damage is present, what kind of vision impairments are present, what kind of problems there are in your vestibular system, like how strong your legs are able to become. But unless you are constantly exercising and trying to improve that thing, you're not likely at your full potential. And that's what we work with through exercising in order to improve these things and improve your balance. So I see this all the time. None of us are really at our full potential, but through some work we can certainly get there. Okay, so how much does this actually work? So this is a study where they basically looked at a bunch of different studies regarding kind of preventing falls and how helpful exercise is with that. So, compared to people who don't do exercises specifically to improve their balance, people who do these balance and functional exercises, it does reduce the rate, it does reduce the rate of falling by 24%, and it does reduce the number of people experiencing one or more falls by 13%. And then there are a lot of different kinds of exercise that can be done. Most commonly, there's balance exercises and functional exercises. Functional exercises are basically exercises where you're doing motions kind of that you do in everyday life, like walking or getting up from a chair. And then, yeah, so if you're doing those things, then they can reduce the rate of falls by 34% and the number of people experiencing one or more falls by 22%. And then Tai Chi, for anyone who's interested in Tai Chi, that's actually really, really good for your balance, and it can reduce the rate of falls by 19%. So this is, these are pretty significant numbers. And again, it's something that I really commonly see when we do have people kind of try to optimize their level of their performance status, that they do fall less and they feel more confident to the point where they're not, as scared of falling anymore. Okay, so before we get into the actual exercises here, I just want to say, if balance is an issue for you, you really should be working with a physical therapist. If you're afraid that you're going to fall, you really should be on physical therapy, unless you ran out of benefits or you used up all your visits for the year for some reason. But it's something, if you haven't, then something that you should do, just because if you try to do these exercises by yourself, and everyone's levels are very, very different. So everything has to be customized, everything has to be individualized, because of all those different factors that I talked about are different for everybody. So again, if you feel like you're afraid to fall, I would not say that you should be doing these kinds of exercises like by yourself necessarily. If you're with somebody who can catch you and they're a relatively reliable caregiver, then maybe. But really, you should be doing this under the guidance of a skilled therapist, such as a physical therapist, or maybe an experienced personal trainer. Just because, again, people can also fall while practicing exercises to help them not to fall. And like I said, you break something, you hit your head, you're in the hospital, you might end up in a skilled rehabilitation facility. So please, everybody at home, please keep that in mind. Okay, so in that said, in general, I can go over a bunch of different balance exercises here. And these different balance exercises, you can hold them. Honestly, you just start wherever you are. You hold it for as many seconds as you can, and then you just do whatever you can, and you just try to increase the level. But in general, you're kind of going for 10 to 60 seconds per repetition. Then for strengthening, you just generally want to aim for 8 to 12 repetitions with 2 to 3 sets. And then you might want to do that 2 to 3 times per week. Some people say every day, but I would say the minimum you should be doing these kinds of exercises is 2 to 3 times per week. So that said, we can get into it. And you'll, oh yeah, sure, we could do questions.
There was a question online. What kind of doctor should you ask for to evaluate your balance deficits?
The best kind of doctor would probably be a physical medicine rehabilitation doctor, if you can find one. After that, I would say it would probably be a neurologist maybe. But preferably, I would say physical medicine rehabilitation. But if you can't find that, that would be for physicians. Physical therapists, they're going to be widely available, and they would also more than adequately be able to evaluate your balance. Or was that the only question? Yeah. Oh, okay. All right, great.
Any questions first before we get into the exercises?
Yes.
I've been wearing Hokas for many years now. My knees, but they're thick. The soles are much thicker than a normal gym shoe. I'm seeing that as a trend.
We're not hearing.
Shoemakers are having it. I do notice that there are times when I'm like, oh, that's a little off balance. What is your experience with that type of shoe?
So yeah, right. Thank you so much for that question. So for everybody at home, the question was, Hokas they kind of have a thick sole, and when you have a thick-soled shoe, that can kind of put you off your balance. So yeah, to answer your question, it really depends. I'm going to say that I haven't really looked at any specific studies on this, so I can't give you a research-based answer. Based off of personal experience, I would say, you want something not with a super thick shoe. People with platform shoes or heels, they definitely have a harder time. That said, for different people, depending on your individual situation, it might be better. Like, again, people with chemotherapy-induced peripheral neuropathy, all the time, they tell me, like, Hoka's are the #1 shoe for, balance issues when you have neuropathy. I think one person told me that Skechers was better. But in any case, yeah, if it helps you with that, and then that kind of gives you some, because maybe like it helps you feel the ground better, yeah, then I would say the best thing is to try different things. And then just, yeah, it really, I would say it's really trial and error. But in general, yes, I agree. The thicker it is, probably the worse off you'll be. Yes, please.
I had a personal experience with minimalist shoes. I had a fractured toe. I always favored it when I walk. And I switched to minimalist shoes 8 years ago. And it took some getting used to, but you start using all the muscles in your feet, which helps with your bones.
Yeah, thank you. Yes, thank you so much. So for everybody at home, there was just a comment that switching to kind of minimalist shoes, and I assume they were talking about the things where like you can kind of see your foot or like all your toes, but that that helped with pain as well as just kind of increasing muscle strength. Oh, okay, yes, yeah. So it's the shoes that are extremely malleable that have much less contact. So again, yeah, different things are going to work for different people. So, I would say just kind of trial and error to see what works best for you. Any other questions? Okay, so we move on, Rebecca.
Just really quickly, for those online, if you want, right now, you'll see the presentation and Dr. Chang might be very small, but if you put your mouse in between the two videos, you can be able to toggle it by moving it to left and right. So you can focus on when you want to see the presentation bigger and then when you want to see him bigger. So just put your mouse in between the two videos and there'll be a white line. And use your mouse to move it to the left and then move it to the right. So hopefully that helps for people.
And just for anybody at home, I'm not encouraging you to do this at the same time as me unless there's someone with you who can like monitor what you're doing and catch you if needed. So please don't do this with me unless you're 100% sure that you'll be okay. Okay, so is this good? Should I move over?
You're fine.
Okay, all right, so yeah, there's a lot of different exercises. This is probably like the first one, like the most simple one. And again, this is just a stance that you literally hold. So like I was saying, regarding base of support, it's easier to stand when your feet are further apart, harder when your feet are closer together. So one of the first exercises is you just put your feet as close together as possible, and you can put them right next to each other if you can. And then, yeah, you just try to hold your balance like this. And again, if you just start wherever you are, if you can only do it for a few seconds, then that's fine. But if you can do it for a longer period of time, like 10 seconds, 60 seconds, I mean, honestly, if you can do it for 60 seconds and you don't feel like wobbly at all and you're okay, then, that's pretty good. And then in the image on the right, we can see that she's standing on something that's a foam pad. So for anybody who's done physical therapy for this before, they will know that sometimes they have you like barefoot and they'll have you like on maybe a thick foam pad that might be maybe 6 centimeters, like 3 inches thick. And it's just because it's harder to maintain your balance on soft surfaces. Sometimes, like if you don't want to like get one of these pads, and you can get like a pillow, like maybe a thin or a thick pillow, and try that at home. But again, you just go on kind of a more uneven, difficult surface, and you just try standing with your feet together on the uneven or the harder surface. So everyone looks okay right now. Okay. Okay. So it's generally people are in their shoes. And I would say if you're having problems with balance, I would start in your shoes. Okay. No one's gonna fall while trying to. Okay, please don't do anything unless you're like 100% confident like that it's going to be okay.
By a chair, be by a wall.
Yes, yeah. So just if you feel like there's if you feel like there's something you can't do, don't try it right now. Okay, so moving on here to kind of more difficult stances. We're going to start in the middle picture here. So what she's doing in the middle, and again, we're just narrowing our base of support, okay? We're narrowing our base of support. So in the middle, she's doing what we call a semi-tandem stance, okay? Staggered, where one foot is slightly in front of the other, and you're squeezing them right next to each other. And again, we're just trying to hold our balance in this position. And we're going to try to do that for, if you can do it for 60 seconds, then that's great. And you can kind of move on to the other thing. Okay. Yeah, so again, this is a semi-tandem stance, and you just try to keep your balance in this position for as much as possible. And again, for these kinds of static positions, this is something I would say you should do every day. And you can do it for, maybe like, you could do several repetitions. I would say maybe 5 to 10 minutes per day. I'm sorry, was there a question?
Yeah. Should my toe be touching my heel with this, or should I?
No. So for this one, for the semi-tandem, your toe should not be touching your heel. I'm sorry, you probably can't see me, but.
6 inches, 8 inches.
So it's like you're hugging, like, I don't know, like the front of one foot. Yeah. Okay. Thank you so much. Appreciate that. For everybody at home, the comment was just for if, your heel should be to your toe. And I said, no, not for the semi-tandem stance. But that's the next one. So the next one is the tandem stance. And that one is where your heel is touching your toe. This is very difficult. If you're going to try this right now, I'd ask that you're holding onto a chair or a wall or something. So please don't try this unless you're holding on to something. Okay. Okay, but essentially your heel is touching your toe fully, and this is like kind of your most narrow stance. And a lot of people aren't going to be able to do this. Whenever I'm doing this with patients, I lose my balance sometimes, so this is pretty difficult. So again, no problem if there's some difficulty. But again, with this position, you just want to try to hold it for 10 seconds if you can. And then if you can't, then hold it for longer, or if you can, then you can hold it for longer periods of time, like 30 seconds or 60 seconds, and then again do several repetitions throughout the day. Yes, in the back.
The weight primarily on the back leg?
Or I would say that's less important. You're going to be shifting your weight most likely. So it's just as long as you can maintain your balance, and if you shift back or forth, I would say, yeah, that's less important. But what you can do, yeah, exactly. So what you would do is you just alternate your legs. So whatever, like you're putting more weight on, then you get kind of the same thing on the other side. Oh yeah, okay, so sorry about that. So the question was just if you should keep more weight on the front leg or the back leg. And we were just saying that you would just alternate your next repetition to the other side. So, whatever leg you happen to be favoring, that, you'll favor the other leg for the next repetition. Yes, please.
What does it mean if you have significantly more trouble on one side than the other?
So the question for everybody at home is, what does it mean if you were having significantly more difficulty on one side than the other? It would mean that you may have some kind of asymmetry, either from a nerve issue or a strength issue, or it could be a pain issue, like knee arthritis or hip arthritis, or it could be many, many different things. But if you are, and you do feel that kind of asymmetry, then again, you want to see a physical medicine rehabilitation doctor or a neurologist for further evaluation. Okay, so, so finally, kind of in terms of these stances, the last thing we want to do is a single leg stance where you lift up one leg entirely, and then you try to balance on one leg. And you don't have to bring your other leg up to 90 degrees, but you can if you just want to hang out down here. That's totally fine too. But yeah, this one is also a pretty difficult one. So if you can do 10 seconds or more, that's great. If not, you just build up wherever you are. And then you just want to go to the other side and make sure you do that too. You just stand up on one leg and try to hold your balance. Again, being mindful of where our center of mass is, where our center of gravity is, and keeping it within that base of support. Okay, so any questions about these? Yes, please.
These last two, if you unlock your knees just a little bit, is that all right?
Yeah, that's totally fine. The question at home was just, is it okay if you unlock your knees while you're doing these single leg stances, or the tandem stance, and yeah, that's totally fine. Okay, so moving on. These are kind of more advanced. So I would say only try this if like you're 100, like you can do this tandem stance for like a minute or longer, and you can also do like a single leg stance on both sides for like, 30 seconds or longer. Then you could maybe try these. But basically on the left side, you can see it's a star excursion exercise, but essentially you stand up on one leg and then you move your other leg forward, backwards, and then to your right, and then to your left. And you're essentially kind of doing the outline of a star in every direction. This is not easy. So again, do this unless you're kind of totally confident that you can do this. And then you would go on the other side and again, do it every way. Go forward, backward, side to side, and then kind of this way and that way. And then another way you can do this, if you're looking for a different kind of challenge, you can, instead of moving your leg, you can just reach out. So you move your arm forward, backward, side to side, and you can use your other arm, whatever you want. But it's just about distributing your weight so it forces you to shift to kind of maintain balance. Again, only try this if you're confident you're not going to fall. And again, you should have somebody watching you or monitoring you. The exercise on the right, where you just kind of rock onto your heels and then onto your toes. And then you can go on your heels, then on your toes. And then you could just try on your heels. And then you can just try standing on your toes. And then you can do like 10 repetitions of that. Maybe you try to stay on your toes for a couple of seconds, just stand seconds. But just, you can do like 10 repetitions of that. But again, this one is a more difficult one, especially for anybody who has anybody has a foot drop, you may not be able to do this one. And that's okay, but yeah, it could be difficult in those situations, so I wouldn't try it. Okay, so those should be all the balance exercises. The leg strengthening exercises, I'm not gonna be able to fully demonstrate, but the other, component of improving balance is strengthening exercises. So you kind of want to be doing both. There's a lot of evidence that both of these kinds of exercises are helpful. The major muscle groups are kind of, again, are all the major muscle groups in the legs. And we're concerned with our quads, our hamstrings, our gluteus muscles, as well as our core. So you can see, you can either do this in a gym, or if you get some resistance bands from home, you can do them using those, but you just want, extending that knee to strengthen your quads. And then your hip abductors, I would say that maybe this one's even more important than your quads. If you only are going to do one thing, I would say strengthen your hip abductors, because those allow for your pelvis to kind of be held at a level position. Now, hip abductors are basically the muscles that allow you to swing your leg out like this. So you're swinging your leg out like this. So these are all exercises like these shells with the resistance band in the middle, or on the far right, these hip burners where you're lying on your side and then you're bringing your leg up and down. And again, for these kinds of strength exercises, we're aiming for like 8 to 12 repetitions, 2 to 3 sets. And then for strengthening exercises, some people say do them daily. I say do them like 2 to 3 times a week. Enough, but yeah, 2 to 3 times per week you're aiming for. And then again, just some kind of these would be exercises to strengthen our hamstrings. So you're just bending your knee back, either with resistance from a resistance band or with weights or a machine at the gym. And then finally, our core is really, really important. There are many different ways to strengthen our core. For strengthening our core, we want to be really careful. For anybody with osteopenia, you have to be really careful with these exercises. Something like a sit-up, like a exercise, it could worsen those kinds of issues. So I would not recommend doing that. In general, we want to have our spine straight when we're doing core exercises. So we really like planks. So you can do a full plank if you're able. If not, you could start with maybe like a knee plank. But essentially, keep in the picture on the far right is bridging. But yeah, you just want to do something where your spine is kept straight. And in general, if anything, if any exercise is causing or worsening pain, that's not a good thing. You should not do it because you could be causing kind of more injury. Okay, so I think that's everything I have, and I'd be happy to take any more questions from anyone else here or at home. Yes, please, in the back.
You speak on the benefits of isometrics.
Yeah, so the question was, can you speak on the benefits of isometrics? So for everyone who's unsure of what that term means, there are, so isometric is a type of exercise where basically you're not moving, okay? So when you do kind of the regular exercise where you think of like where you're moving, we would call that like a concentric exercise or like an eccentric exercise. But when you're doing isometric exercise, you're applying resistance, but you're not actually moving anything. So you think of something like a wall sit, like if you're against the wall and you're just like holding this position, or like a seated squat and you're just holding that. I would say isometrics, they're really good for building strength. I don't know if they're actually found to be better than supposedly the type of exercise that puts the most amount of pressure on your muscles to actually build them would be eccentric exercises. And eccentric exercises, you're actually doing kind of like a negative, where you're having the muscle lengthen under resistance. So that's supposedly the best kind. But isometrics, I'd probably say maybe it's better than concentric, where you're actually shortening the muscle. That said, if you're doing something, I would say it's better than doing nothing. And then I would also say, the purpose of all this kind of exercise, it's not to, you shouldn't be going completely to your limit. And I would say you should be doing everything at a moderate intensity. I would not do anything where you're trying to go to failure. Like I wouldn't try to do a hold squat position and do that until I can't do it anymore. Because if you're pushing yourself to the full limit, there's a higher chance you're going to injure yourself, like in some way. So just something to keep in mind. Great question, thank you.
Any other questions in person or online?
Yes, please.
Plenty of extra bands for us.
I left them in Los Angeles, but maybe next time. Yes, exactly. Consult Amazon. Yes, please.
That's a good question. How do you tell, like, if you constantly have like pain in, it feels like your bone,
Like here?
Probably your muscle. Like, so you have that all the time, but you don't want to quit exercising. So like, especially after exercise, you'll have it, that you don't want to stop. How do you know how much, what I'm asking, like, how do you know how much to do?
Right.
Not to do. So like, gentle exercise.
Right.
Tai Chi, swimming and those kind of things. Do you just keep doing it?
Right.
When you have hip pain?
Yeah, thank you. Yeah, thank you so much for that question. It's a great question. For everyone at home, the question was, if you have like some sort of pain somewhere, like pain in your hips, like how do you know like how much exercise to do, how much you shouldn't do, like how hard to do it at? So essentially, if you know what's causing the pain, then it depends on what that thing is. If you don't know, I would say you have to get that looked into. Like maybe you need x-rays, maybe you need an MRI. But if it's constantly bothering you, because the idea is we don't want to be doing more damage. Like maybe that's due to like a tear of some of like your quadriceps muscles, or a problem with the tendon. That's something that has to be looked into. Maybe you need to see like an orthopedic doctor to see if there's some kind of intervention that needs to be done. If it's something like, it's coming from like arthritis, maybe it's like some mild or moderate level of arthritis in that area, then you could be like, okay, then it's really a this kind of thing, like how much pain do I want to be in, like how much is this like exercise helping me? In general, I would say the best thing to do is not work through pain or push through pain, because not all the time, in cases of chronic pain, this isn't true, but a lot of the time when pain is like new, it means something's wrong. And you have to get that checked out and you have to find out what that is. And if there's a way to intervene, then you should seek whatever that intervention is. But yeah, otherwise I would try not to like push through pain, because there's generally some other type of exercise you could probably do that maybe may not hurt it so much. So for example, it's really common for people that have knee arthritis or hip arthritis, and it hurts them to run. But that doesn't mean that you can't get aerobic exercise. A lot of them will be able to tolerate like pool therapy. So you just like go to a pool and you walk around, you're still getting aerobic exercise, but without like, potentially causing further damage to like your hip joint. So great question. Thank you so much.
I just want to speak from my experience to answer your questions. Exactly what you said. I had some pain in my shoulder, but I had a history of my shoulder pain with calcium deposit. This one started to have pain. I could not elbow out to open my car door. So I noticed the pain. I thought, well, am I going to force it or not force it? So I went to a orthopedics and did an MRI and checked it out. There was no tear and everything was right. I mean, it was so okay. So he said to me, keep working that elbow, keep, using it. Don't be afraid, even if it hurts. And sure enough, he was right. I can elbow out my door.
Yeah, thank you so much for sharing your story. It's just for everybody at home, just sharing a story about how, there was some shoulder pain. She saw an orthopedic doctor to figure out what the problem was, and it all turned out well. Thank you so much for sharing that. Any other anecdotes or any other questions or comments? Yeah, yes, please.
Early on in your talk, you talked about sorry.
Oh, no, that's okay.
Because it's just happening to me. I think you talked about infection and cognition.
Mm-hmm.
Can you speak more on that? Because I'm literally only now just experiencing that. It's like super sudden onset.
Yeah, certainly. So the question was if I could just speak more to kind of the role of cognition from earlier in my talk. So in regards to balance, it's just important just so you know where you're going and you're not confused of where you're going. So for example, somebody with like, Alzheimer's, dementia, like that may be kind of advanced, like, you may ask them to get up and then they may not know where they're going. So, they may like be shuffling kind of around to different areas. And when you don't have a good idea of where you're going, then, you will be more liable to fall. If you're talking, if your question is kind of alluding more to, what's going on, I would highly recommend, if this is something new that hasn't occurred before, you definitely need to be sharing that with your medical team. Either, I'd start with your oncology team or your primary care doctor. It may be important to see a neurologist and be worked up with further testing.
Which I am, but in the meantime, I was just curious if you were making a connection between possibly an infection and cognition. So it's like all of a sudden, it's like the letters I don't recognize, certain words I don't recognize, and it just like happened suddenly.
Okay.
That was accompanied by low-grade fever.
Okay, so
I did have a brain MRI. I'm waiting on the results. They did it yesterday.
Got it.
But it's got me freaked out, and I just wondered if you had any insight on what could like bring that on suddenly.
So the question at home for everyone at home is just kind of the relationship between having a possible infection and how that can impact cognitive function. So there are many, many, many different things that can cause cognitive impairment. Infection is one of them, but it's not for sure that, whatever you're experiencing necessarily would be caused by an infection. It could be, but it's not for sure. There are a lot of different things that could be contributing to that, but short answer, yes, infection could be one of them.
Another question, maybe a week or so ago, you had another talk that I attended virtually, and you talked about a certain type of, like I have chemo-induced neuropathy that hasn't gone away, despite, physical therapy, talking to doctors, and you mentioned some kind of a
That off after the workshop.
Okay.
Any other questions related to balance or anything that you covered today? Just close it up for this one. Wonderful. Well, thank you so much for those who joined online. And thank you, Dr. Chang, for your presentation today.